We've made our way back to Team Rehab Physical Therapy, talking with Josh Butcher. The topic today, sciatica. It feels icky just to say it. So the condition, everyone's heard the term, but not everyone's familiar. What is sciatica and why is it important to take care of it?
Yeah, sciatica is super common, one of the most common things we see in therapy. But it's not really the condition, that's a symptom of a condition. So that's why you can't just give somebody a generic plan for sciatica, because we have to know where is that sciatica coming from first. It can be a back thing, it can be a hip thing, it could be peripheral down the leg somewhere else. So that's why, coming in and getting an assessment and really nailing down where it's coming from is how we figure out how do we treat it.
And how do you evaluate where that pain's coming from?
So first I should say what actually sciatica is it's that nerve pain down the leg. Typically the back of the leg, sometimes kind of the back and side of the leg, can stop above the knee, can go all the way to the foot, oftentimes towards the outer foot or the bottom of the foot. And it's a nervy type pain, often described as burning. It can be numb, tingling, shooting, those kind of qualifiers for nerve type symptoms. So how do we figure out where it's coming from is oftentimes the history. What positions do they not like? How old are they? What are they involved in? What are the triggers for that pain? That sometimes will tell us exactly mechanically what's going on, sitting versus standing. But also just your movement screen, looking at a thorough lumbar spine evaluation, looking at a thorough SI joint, looking at all the areas where that nerve goes down the leg as it exits the spine, and determining, really when those joints move or those muscles move those joints, does that reproduce the pain? And then you can kind of rule in or rule out where it starts.
And why is it so important to get on a treatment plan as opposed to trying to tough it out?
Well, when we're talking about nerve pain, they're a little finicky, they get irritated easily, and then they're hard to calm down. So I think it's really important if you get in towards the first sign of it, when it's a condition that's coming and going and is not constant. I mean, if you wait to the point where now it's most of the day, it's hard to get away, you can't stretch it out anymore, you don't start the day without pain, that's where it becomes trickier to unpack all that and go back to the beginning. So if it starts near the back or the buttocks and it's up higher, that's a good place to start. Once it starts to creep away from where it probably originates in the back or buttocks and gets further widespread down the leg, it can be a little trickier to treat as well.
And what might a physical therapy plan for this look like? What does it play out like?
So number one, the evaluation is the most important. That first hour visit that you get with us, we really figure out where it's coming from. That's the most bang for your buck. We can give you a good plan of exercises to try to alleviate that pain, which is taking pressure off the nerve or decreasing irritation to the nerve. That may mean just telling you what activities not to do to stop triggering it so much. It's usually a combination of some hands-on treatments. Maybe we're doing some decompression on your back, maybe we're doing some manual mobility work on your hip. Depends again where it's coming from. And then pairing that with, it could be strengthening that hip to stabilize, it could be stretching your core and your back a certain way to alleviate that pressure. Again, it just depends on where it's coming from.
Well, Josh, thank you for educating us more on this topic and letting our viewers know about what they need to do if they're dealing with sciatica.
Yeah, thanks.
For more information, you can check out the details up on your screen right now, and be sure to let Josh know that you saw him right here on 21 Alive.